Good afternoon. I'm John Cortale, and thanks for joining today's webinar on Medicare. In the 20 years I've been a financial advisor, Medicare is by far and away the most confusing topic for clients. We get questions all the time from clients about the different parts of Medicare. What is Part A, Part B, Part C, or even Part D? We get questions about where does supplemental insurance fit in? Another question we get is, how do you deal with Medicare if you're 65 and still working? These are just some of the questions we get seemingly on a weekly basis from clients. Well, thankfully today we have Danny Cohen, who's the Senior Vice President, Medicare expert from John Hancock, to answer these questions and many more. Danny, please take it away.
Sure, John. Thank you very much. I appreciate everybody joining today. John, you can hear me okay?
Yes, sounds great.
Okay, good. And you can see the screen, so we should be good. All right. Well, I guess I'm going to help you all understand Medicare a little bit better today. I think that many of you probably have a lot of questions, as John mentioned a few. So I think taking you through this presentation will help. It is a little detailed, and sometimes my accent, it sounds like I'm from New York or I talk fast. It's a Canadian accent, so you'll forgive me. I'll try to slow down on certain parts, especially where I think it's very important and may pertain more to your particular situation here. So here we go. So understanding Medicare. So typically what happens just before your 65th birthday is you get inundated with mail and just people calling you, trying to sell you some kind of insurance plan when you hit 65. And you tend to get a lot of things in the mail. And more often than not, you look like this couple where you're sitting at a kitchen table and you're staring at all these documents and really trying to figure out how Medicare works. And it really does beg the question, is this how understanding Medicare makes you feel? It is confusing, and there isn't really one place to go to that really can explain it to you. There's a lot of good videos out there, but there isn't necessarily a number of financial advisors and planners that are able to help you with this as well, because a number of them don't actually sell Medicare. But of course, they want to keep you well informed, and that's why they bring people like me in to talk to you about understanding this. So our topic today will be history of Medicare, Medicare parts and when to enroll, Medicare costs, Medigap plans, Medicare Advantage plans, and of course, the one that everybody wants to know about is working past 65. So let's get into the history of Medicare. Most people don't know that Medicare was actually signed into law in July of 1965 by President Lyndon Johnson. And of course, it was a huge day in American history. And the reason is because prior to Medicare, over 50% of seniors, when they retired, really didn't have health coverage, especially in hospital coverage. So it caused over 8 million seniors to be living in poverty at that time just because they couldn't keep up with their medical bills. And you'll notice that President Truman and his wife, Bess, were actually the first two recipients of Medicare Card 1 and 2. And the reason for that is that when President Truman was in office, he was a big proponent of a national health care program, and Medicare, though many of his proposals were defeated when he was in office, it wasn't until President Lyndon Johnson came in that they were able to get Medicare passed. But President Lyndon Johnson felt that Truman was such a big proponent and a big reason why Medicare even existed, that's the reason why they got Medicare 1 and 2. So initially when it came out, 19 million beneficiaries enrolled at that time. Today, there's over 61 million people enrolled in Medicare, and about 40% of those people are on what you know as Medicare Advantage plans. And we'll talk more about that as we get into the presentation. You'll forgive me there. I thought I actually took this plug out. All right, well, we'll have to let that go. I apologize for the background noise. I took a plug out, and I'm not necessarily sure why that ringing is going on, but I'll let it stop here. Oh, there we go. Okay, so Medicare starts with the parts. You have Part A and Part B, and you have Part C and Part D. This is where it gets confusing for people because many people don't realize that there's actually 4 parts, and here they are. Part A is your in-hospital coverage. It is really, think of this as your room and board. And most people have Part A for free because during the course of your work life, this is what you've paid into your FICA taxes. And that typically gets taken out with your Social Security as a deduction from your paycheck. So for most people, it's free. And we'll talk more about this, but this is your in-hospital stay. Part B is where you tend to get a lot of these questions about, should I take Part B if I'm working past 65? But Part B is your outpatient coverage. And you can see a list of the things that it covers. It's doctor visits, lab work, preventative care, outpatient surgeries, physical therapy. You see all these listed things, and you'll see Part B covers 100% of preventative care and 80% of all other outpatient care. So what's important to know here, when we say preventative care, we're talking about things like a mammogram or a vaccine like the COVID shot or a flu shot or a colonoscopy, a diabetic screening. These are all things that are considered preventative care, and Medicare will cover 100% of these things because they are considered preventative care. You'll see things like physical therapy or an outpatient surgery where that's covered at 80%. So as an example, let's say you need a knee replacement or you need a cataract surgery. These are things that are considered outpatient surgeries. Thereby, Medicare pays 80% of the bill, and you're on the hook for 20. Where this gets a little scary for people is if you get cancer and you need chemotherapy here or dialysis from kidney failure, that's where you're on the hook for 20% of it. And I'll explain that a little bit more as we go on. But you'll see the little photo here at the bottom of the gentleman smiling in the doctor's office. And as I've done this presentation, I keep staring at this guy and ask myself, why is he smiling in a doctor's office? And I realize is that he has not seen the bill yet. And that's something that I think when all of us think about, okay, what's covered, what's not, you're still going to be on the hook for some of it. So these two make up what's known as original Medicare, Part A and Part B. These are the only two parts that you get from the federal government. The two parts, A and B, were actually modeled after the early 1965 Blue Cross Blue Shield plans, where they had an in-hospital coverage component and they had an outpatient component, and those now make up what you know as original Medicare. Part C came after. This is known as a Medicare Advantage plan, and this is not something that you have to get. And I think this is a big thing where people get confused on all the parts, because Part C came out in 1997. It was signed into law as a part of the Balanced Budget Act that was signed in by President Clinton at the time. And basically, I like to think of Part C as a travel agency where you can get all the parts, Part A, Part B, and Part D, all from one place, Part D being the drug program. And that makes up what you know as Medicare Advantage plan. So in my analogy of the travel agency, that's like me saying to you, hey, you can get the flight, the car, and the hotel all from one place. Or yes, you can buy it a la carte, each on its own as well. But that's where Medicare Advantage plans come in. Part D is what I mentioned as voluntary drug program. This was signed into law back in 2003. It came out and went live in 2006. And this was a huge thing because a lot of the outpatient Part B drug coverage, for instance, if you got cancer and you needed that medication during chemotherapy, a lot of that is where you were on the hook. And now that Part D came out, a lot of that is covered and really does help people. So this is what you know is your pharmacy card. And of course, we'll talk a little bit more in detail about that as we go along. So most people want to know, how do I enroll in Medicare? And just so you understand, it's done through the Social Security office. But if you work for one of the railway companies, you do it through one of the Railroad Retirement Board offices. And then you'll see here that if you're already receiving Medicare, you're automatically going to be enrolled. Excuse me, if you're already receiving Social Security benefits, you're going to be automatically enrolled where it will come out of your check right off of the bat when you hit 65. Now, if you're not already enrolled in Social Security, you'll get billed quarterly. And then, of course, if you're working past 65, you can delay, and we'll talk more about that as we go on here. But the most important thing to know about Medicare when you hit 65, especially, is your initial enrollment period, which lasts about 7 months here. And how this works is it's 3 months before your birthday month. It includes your birthday month, and then it's 3 months after your birthday month, and that's how we get to 7. And just to kind of give you a simple example, if you turn 65 on May 20th, your initial enrollment period would run 3 months back from May 1st, which is why you see February 1st, and then 3 months forward from your birthday month, which would expire on August 31st. So it's always on the first day of your birthday month. It's not 3 months back from May 20th, just so everybody understands that. So obviously the question that then comes from most people is, when does it start? And that really depends, obviously, on when you enroll. So if you enroll prior to your birthday month in those 3 months I mentioned before May, which is February, March, and April, you would start on the 1st of May here, which is, the 65th month of your birthday. Where there's an exception is if you're born on the 1st of the month. So let's say that your birthday was on May 1st. You actually would go effective on April 1st, a month back, and your initial enrollment period would now be January, February, and March. So it would start a month earlier. About 7% of the people have this that are born on the 1st of the month, and this works the same way with Social Security, and this kind of gives you a sense of how that works. So what happens if you enroll during your birthday month? Well, then it's delayed a month, and you wouldn't start until June. And then if you start a month after, it'll be delayed by 2 months, and then, if you start 3 months after, then it'll be delayed by 3. A lot of people ask, well, what happens if I miss this enrollment period at 65 and I'm not working past 65 where I can delay it? Do I get another enrollment period? So there's a general enrollment period in the first quarter of the year. The only negative to that is if you do it during that time frame, Medicare does not go live until July 1st. So if you need coverage, that could present a problem for you. So let's talk about the Medicare cost sharing now. So just so everybody understands how this works, the first thing you pay when you have a health insurance plan is your premium. So for instance, I'm working at John Hancock Investments. We're a big company, and then every 2 weeks out of my paycheck, I get my healthcare premium deducted from my check. But then when I go to use the medical services, I have to pay a deductible. There's co-pays when I go see the doctors, and then of course co-insurance. And that's what is cost sharing. So most people understand the premium, but they don't necessarily realize that, okay, once you use the services, you may have additional costs. So just to kind of give you a sense of Medicare costs and some of the out-of-pocket expenses, I think at least on the Part A hospital coverage, it's important to know what makes you eligible for Part A. And this is a lot of writing. So what I'm going to do is I'll read it and then I'll ad lib to what I'm reading here. So Part A costs nothing if you worked and paid into FICA taxes for at least 40 quarters, which is 10 years of work history. This is the same thing that qualifies you for Social Security. You have to have worked 10 years. Most people ask that question, well, what if I work 9 years, 6 months? Can I go back to work part-time to get these 2 extra credits I need to make sure I'm eligible for Medicare and Social Security? The answer is yes. People do it all the time. Then you'll see you're considered paid up for Part A, and it will cost $0. And that's if you paid in, for these 10 years. So people ask, well, what if I only worked 30 to 39 quarters? How much is Medicare Part A going to cost me? So that's going to cost you $259 a month. And remember, it's per person, per spouse. If you don't have, let's say, 30 quarters, you're under 30 quarters, it would cost you $471 for 2021 to get Part A. If you don't get it, you can incur a penalty there as well. So it does beg the question, if I'm married to somebody and I qualify under them, yes, you do. You can see you qualify for this Part A under your own work history or a spouse's work history. As long as you've been married a year, your spouse must be eligible for Social Security benefits. So here's an example for you. You're turning 65. You want to go off the work record of somebody who's 61 that you're married to, and you're thinking to yourself, you're going to be able to file for Medicare based on their work history. The answer is you're going to have to wait a year. And the reason is that person that's 61 that you're trying to collect the benefits off is not 62 and eligible for Social Security. So you at 65 would have to buy Part A for that 1 year to age 66 in order not to incur a penalty. A lot of people don't totally understand how that works. But like I said, the spouse must be eligible for Social Security. In a divorce situation, it works the same as Social Security. You qualify under divorce work history if you're married at least 10 years and the spouse is eligible for Social Security and you're single. You can qualify also under a survivor situation for widow or widowers, but you have to have been married at least 9 months before the spouse died, and you're single. If you remarry in a survivor situation after 60, you can still keep your Social Security and Medicare benefits off your first spouse. So just keep that in mind. It's a different rule than if you're in a divorce situation. So I talked about Part A premiums, and for most people it's free. Let's move on to Part B and Part D and the Medicare costs. So this is where a lot of people ask that question, what's the story with Part B and Part D? So the monthly premium for Part B right now for base premium this year is $148.50 a month. And then, like I said, if you're already receiving Social Security, these premiums get taken right out of your check monthly. And then if not receiving Social Security, they get billed quarterly. You can set up an easy pay account on Medicare's website where you can actually get billed once a month. A lot of people like to pay the bill monthly rather than paying it over a 3-month time frame. I think what you care more about is what's known as this IRMA for high earners. So IRMA stands for Income Related Monthly Adjustment Amount. And this came out in 2007, and I can tell you nobody was happy about this, because now what happens if you make more than 88,000 as an individual or 176 joint, you now have this sliding scale for Part B and Part D, which is based on your modified adjusted gross income on your tax return. So just to get a good look at this, how this works is in 2021, excuse me, if you're retiring, let's say, and you're 65, your Part B premium is based on a 2-year look back. So they're going to look back at 2019 at your modified adjusted gross household income. So in essence, they're looking at your income as to when you were 63 years old, not 65. And if you're over, let's say, 176,000 here in the joint, which is what I was talking to you about a little earlier here, you're not now paying $148.50. You're now going to be paying $207.90. And remember, it's per spouse at 65. So this becomes really important, because sometimes what happens is at 63 years old, people don't really understand this. So they say, hey, I sold an investment property and now I have additional income, or I took distributions from an IRA that are taxable. These are things that get included on your tax return and could push you up when you hit 65 to pay premiums as high as $475.20 in essence a month, or $504.90. So a lot of people want to file an appeal when they retire. Let's say it's 65 or 68 if you're working past 65. And you can. So on the Social Security website, there's a form called SS-44, which is a form that John can help you out with. But you'll see it in the notes here as well. And this form is what they call a request for reconsideration. So what Social Security and Medicare are looking for in this situation, because they work together, is a loss of income. So if you retired, let's say at 65, and now your income has changed, right? You're not earning as much as you did at 63, the 2-year look back, or you went through a divorce or there's a death situation. This is probably where you're going to win the appeal on the Part B premium. So if there's an addition of income, you typically would not win this appeal, but there's no penalty for, filing an appeal, and you can do as many appeals as you need to. For instance, sometimes people need to do it at 65, and then maybe somebody passed on at 69 in your family, and you're getting some distributions on an IRA, or you got divorced, something to that effect, that would cause you to file an appeal more than once. So that's pretty much how it works. I could probably go on for another 6 minutes about this, but I wanted to give you a quick sense of how that works with Medicare and Social Security. The Part D premiums, typically a Part D drug program is going to be somewhere between $7 and $205 a month. The average is $40 a month, but you're still subject to this IRMA higher income scale. And this one came out in 2011. It was a part of the Affordable Care Act. And then you'll see here on the right that if you are eligible for Part D at 65 and do not have credible coverage through work or some type of military or veterans type of benefits or retiree coverage, you're going to be subject to this penalty, and it's 1% a month. So if you don't file for Part D for 5 years and you were supposed to, you could be paying a 60% penalty forever, right? Because that's 5 years right there. If you file an appeal, which in this case would be the same way it works on Part B, you can see the income scale is the same at 176 and above. The premium is different, as you can see on the far right, it's lower. But if you win the appeal on Part B, you basically win the appeal on Part D. If you lose on Part B, you also lose on Part D, so they work together. Typically what happens here is Medicare and Social Security will review your income in December, and then in January, they'll send you a letter if you have an IRMA to pay or not. So let's switch gears. We'll talk about the cost sharing now on Part A. So I covered Part A premium, I covered Part B and D premium. Let's get into the cost sharing now. And this is the part that I think a lot of people don't know about Part A. People think that Medicare is free, Part A especially, because they paid into their FICA taxes. But even though you paid in, the premium is free possibly for you, but not the cost sharing. And here's how it works. Part A has a deductible. So when you go into the hospital, which is what Part A is, your hospital coverage is a reminder, you have to pay this $1,484 deductible. That's what it is for 2021. And it works on a 60-day cycle. So on day 61, day 91, up to that, you can see the copays here on the left. And then you'll see the first 20 days, there is skilled nursing that is paid for by Medicare. After the first 20 days, you're now subject to $185.50 a day in co-insurance from days 21 to 100. So this is where a lot of financial planners talk to you about long-term care, because if you have to go into assisted living or you need long-term home health care, Medicare really doesn't have anything to do with long-term care. So they work mutually exclusive. But how this works with the Part A deductible, and I said 60-day cycle, is let's say you go into the hospital on May 1st and you come out 30 days later on June 1st. And then you go back in on June 15th. That's a 45-day turnaround. So when you go back in, you don't have to pay the $1,484 again, and you just continue on with the copay days that you see here. But let's say you go into the hospital on May 1st, you come out June 1st, 30 days later, but you don't go back into the hospital now until the middle of October. Well, it's beyond 60 days, and because of that, you now have to pay the deductible again and go through all of these copays. So this is something that really bothers people in a significant way, and it's a big reason why a lot of people try to figure out how to cover that gap. And we'll talk more about that. But here's cost sharing for Part B. So in Part B, you've got to pay the deductible of $203 in most cases for people, and that's for each of you. Remember, if you're married, each spouse has to pay for that. And then you'll see Medicare pays 80% of the bill, and then you pay 20% co-insurance. So where this can become very scary for people is if you get cancer and you need chemotherapy, or you have kidney failure and you need dialysis, Medicare will, yes, pay 80% of the bill, but you're going to be on the hook for that 20% chemotherapy and dialysis. And that's where people really get very concerned about what the coverage is for them when they get into their senior years and post 65. So this is where a lot of people talk about covering the gaps. And this is what we're going to get into right here. So there's two ways to do it through the private insurance market. One is Medicare supplement plans, also known as Medigap plans. They mean the same thing, supplement and Medigap. And in this case, this is what you know as the Cadillac service in medical coverage post 65. The premiums are higher and there's less cost sharing. So you almost have no out-of-pocket expenses when it comes to Medigap plans. And we'll talk in detail here in a quick second. And then Medicare Advantage plans are the second way. It's a lower cost way to get health coverage post 65, lower premium, sometimes no premium. These are the ones you typically see Joe Namath, the former quarterback, actually going through this and basically trying to sell you this during football season or during your favorite TV show in the fall. But there is higher cost sharing here, and we'll talk more about that in detail as well. So let's tackle Medicare supplements. So Medigap plans pay after Medicare. So Medicare still pays 80% of the bill, but Medigap plans act as a wraparound around Medicare. So they pay the other 20%. And the good part about these Medigap plans is you don't need a primary care physician. You basically go see any medical doctor in the country, any provider that accepts Medicare. And about 93% of the doctors in the country today accept Medicare. And that's important because if they accept Medicare, if Medicare pays the bill, then the Medigap company will pay the bill as well. If Medicare is not accepted, you cannot use the Medigap plan. So people like Medigap as well because it's great for travel. If you're a snowbird, you don't need to get a new medical plan. It travels with you if you're spending 5 months in Florida, as an example. And of course, there's many different insurance companies that offer these plans, as you know. There's also a lot of insurance brokers and agents that actually represent these same plans. It does not cost you more money to buy a Medigap plan through Blue Cross Blue Shield versus buying it through a Medicare broker. It's the same thing. So when you actually break down the Medigap plans, what makes it easy for people is the plans are standardized. They were standardized in 1990. There's 10 of them. And when I say standardized, I mean the benefits do not change. So there's 10 plans. The most popular one pre-January 1st, 2020 was Plan F. And that plan has now gone away for people who turned 65 past January 1st, 2020. So if you're still working and you turned 65 prior to January 1st, 2020, you're still eligible for Plan F. And Plan F is very desirable for people because as you look at all the Part A co-insurance and the deductible is all covered with this particular supplement Medigap plan. They even give you 365 reserve days beyond day 90, which is very helpful for people if you have a long-term hospital stay. But you can see everything pretty much 100% is covered here, even the Part B deductible. And what happened here is Congress got together in 2019 and basically said, look, we don't want people going to the doctor for every sniffle and cough. We want people to have a skin in the game. So come January 1st, 2020, they got rid of Plan F because they wanted to make sure that people now would have to pay the deductible. So the two most popular plans now are Plan G and Plan N. Plan G has pretty much everything, as you can see on the screen here, that Plan F covers. The only thing it doesn't really is the Part B deductible. So a lot of people like Medigap plans because of the foreign travel emergency as well. So keep in mind, I didn't really discuss this at the beginning, but Medicare will cover you anywhere in the United States. Medicare will. But Medicare will only cover you on foreign travel in 3 instances. One, if you're on a cruise to Alaska and the boat's going through Canada, they'll cover you. If your closest hospital is next to the Mexican or Canadian border, they'll cover you. And then if you're within 6 hours ashore, let's say on a cruise, they'll cover you in that instance as well. But any other foreign travel, they won't. So a lot of people like the fact that these Medigap plans will give you up to $50,000 of coverage. And the Medigap company will pay 80% of the bill, and you'll pay 20% of the bill up to that $50,000. Plan N, you'll see, is a little bit cheaper because not only does it not have Part B deductible, it doesn't pay for the excess charges on Part B. What do I mean by that? Well, if you go see a doctor may not accept the assigned rates of Medicare, so they can upcharge you on the bill up to 15%. So in the case of Plan N, you're not covered there, so you would have to pay an extra 15% on that bill if the doctor upcharges you. In Plan G, that's covered, as you can see, and that's why Plan G is the most popular plan in the country right now. So just some tidbits here on monthly premiums. The Medigap companies set their own rates. So I mentioned to you, insurance agents and brokers can't change them. Everybody's got the same price. They're based off of age, zip code, gender, and tobacco use. There are family discounts, but remember, each spouse has to get their own Medigap plan. And the rates are going to be lower in places like Iowa and Oklahoma. And I don't think you're going to be surprised to see that they're higher in Florida because there's more retirees living there. So when you put it together and you want to look at the costs of all of this, the first thing you need is Medicare when you have a Medigap plan. So you got to get Part A. We said for most people it's free, it's $0. Part B for under $176,000, the base premium under 88 individually is $148.50. And then I said a Part D plan, drug program average is $40. And then a Plan G Medigap plan, this was Texas, but in Northern Virginia and Maryland, it's about $105 to $140 a month. So if we just assume $130, you're looking at about $320 per person in order to get into a Medigap plan. And then you'll be fully covered remember, you need to add a standalone Part D drug program because Medicare does not have it, and either does a Medigap plan. So that's why you see a standalone Part D drug program that you would need in this case. So a lot of people who collect off their spouse as far as applying for Medicare, a lot of times what happens is once somebody turns 65, they'll leave their spouse's health insurance company because they can do it cheaper by going to Medicare, add a Medigap plan and a Part D drug program versus staying on their spouse's work plan. You could save yourself thousands of dollars, and many people have when you turn 65 to going to the route of Medicare, Medigap, and Part D. So when you're in a Medigap plan, the biggest thing that people pay attention to is the open enrollment period. So when you turn 65 and Part B goes effective from Medicare, you get this 6-month window where even if you have a chronic illness like cancer or dialysis coming in at 65, the insurance company will not be able to ask you any health questions. They will automatically approve you at 65 as long as you get into that Medigap plan within the first 6 months. If you're working past 65 and you work for an employer greater than 20 people, you will get another open enrollment period when you retire, when your Part B goes effective, if you've delayed it. So feel good in knowing. If you work for a small company and you've already filed for Part A and Part B, meaning less than 20 employees, that you already now have Part A and Part B at 65, when you retire, you'll have a 63-day window there where there's no health questions to get into a Medigap plan. Excuse me. So if not, medical underwriting, you'll have to go through it. It's a 2 to 5 year health history. A lot of people ask the question, well, if I've had cancer, and the question then becomes, if I've had cancer, what actually should I be doing, or what should I know as far as the period of waiting? So if you're cancer-free for 2 years, it's more than likely that you would actually be approved by the Medigap company. And then in the case of, like, let's say you're on insulin, or you're taking pill form of diabetes medication, there's a good chance if you're on the pill form, you'd be approved. So that gives you a sense of how that works. I must apologize for the phone here. I actually thought I took the phone plug out, so forgive me here. Nobody calls all day. All of a sudden, when you want to do a presentation, they actually decide to. So the Medigap plans, just as far as enrollment, open enrollment, it works differently in New York and it works differently in California. For instance, in New York, you have open enrollment every day. The plans are more expensive in New York, but I think you get the idea here. And then in California, it's once a year on your birthday. And that being the case, you would be able to get into a Medigap plan without any health questions once a year on your birthday. So big misconception that people confuse Medigap open enrollment period with the annual election period. So Medigap open enrollment period, Part B effective date, and then 6 months right after, right? And that's even if you're working past 65. The annual election period is in the fall, and that's the October 15th to December 7th. That's typically when you see the Joe Namath commercials and other insurance companies advertising to try to sell you on a Medicare Advantage plan or a Part D drug program. You can get in and out of these plans if you've missed the initial enrollment period, and that's why it's such a busy time of the year. You may ask, well, why is that the case? And the reason is very much like your homeowner's insurance. If the house is on fire, they're not going to give you the insurance. And the same thing applies for Medicare supplement plans. They're not going to insure you after the fact if you get a chronic illness. So just as a summary, if you're going to get a Medigap plan, the first thing you want to ask the doctor before you go visit them is, do you accept original Medicare? Remember I said that if Medicare pays the bill, then the Medigap company will pay their portion of the bill. And usually what happens is Medicare pays the bill, they send the remaining part of the bill to the Medigap company, and then they pay their remaining 20%. And then if you're left on the hook with anything, then they bill you at that point. But most of the time, you're not really on the hook for anything. So you'll see the plans, as I mentioned, are standardized, so the benefits don't change. And if you get sick when you're already in a Medigap plan, you're guaranteed renewable. But of course, you would still need to own at the bottom here a standalone drug program. So just keep in mind with the standalone drug Part D, normally you would get that at your initial enrollment period. But if you're working past 65, you will get an open window there of 2 months when you retire to get a Plan D program. And you must be either enrolled in Part A or Part B to get it. And you must live in the planned service area. So if you move, you're going to get another guaranteed issue period where you get a special enrollment period for 60 days if you move states to change your Part D drug program. There's 4 stages to the drug program of Part D. The one that most people probably want to know is the Part D deductible. So Medicare set it this year at $445. So, sometimes what happens to people is they go into the pharmacy in January, they're standing 10 deep and, they get to the front, get their medication, and they're wondering why they're paying so much. Is because the first part of what you pay is the deductible before the rest of the coverage kicks in. And you'll see here, you have an initial coverage period, a donut hole, which they call the coverage gap, and catastrophic coverage. And just to kind of give you a sense, what you'll pay for medication in Part D depends on what part of the drug tier you're in. So there's 5 tiers, but if you're on a generic drug, you'll pay less. If you're on a specialty brand, as you know, you'll pay more. And then you'll see here in the initial coverage phase, there's a copay and coinsurance up to $41.30 a month. And then you go into what's known as the coverage gap, the donut hole. So you'll see it's 25% of what you pay between $41.30 and $65.50. This may seem like a lot, but keep in mind, this used to be 100%. So this donut hole used to scare people because everything between $41.30 and $65.50, you were on the hook for 100%. This changed in 2011. This was a big thing that was a part of the Obamacare Affordable Care Act. And this was a big change, obviously, that helped people out. And then you'll see the last phase is catastrophic phase. Obviously, if you're on chemotherapy and you need a lot of expensive medication, you'll see this 5% coinsurance after you hit the $65.50 and some of the copays here. But if you want to get a Part D drug program, you go on mymedicare.gov. You can compare the plans. You can get in of one plan and out of one plan. And a lot of people that missed that initial enrollment period, I mentioned, do it in the fall. So as we switch gears here to Medicare Advantage plans, this is the second way to get private insurance and really get coverage that's more affordable. So you'll see here, you typically get the coverage, like I said, through a private insurance company, but you tend to be in a local network, a smaller network of doctors. And about 90% of the plans have a Part D drug coverage plan. So you don't need, in most cases, to buy a standalone Part D. You must still be enrolled in Part A and Part B to get a Medicare Advantage plan. So you're not getting out of paying Part B premium. I know a lot of people think that you may get it from the Medicare Advantage plan. Some plans have it, but most don't. So you're still going to have to pay for Part B. Keep in mind what's happening here is instead of you getting your benefits directly from Medicare, basically what's happening here is Medicare is paying a health insurance company like Blue Cross Blue Shield or Aetna $10,000 a year to administer your health benefits. And what are health insurance companies in business to do? To make money. So they're going to try to manage your healthcare benefits, which is why these plans break into what you know as a HMO and a PPO plan. So in the case of HMO, you've got to get a primary care physician, as you know, and you've got to get a referral to go see a specialist. There's no health questions to get in, but a lot of people don't like the hassle of the referral or getting a prior authorization for some of the medication. Some people like the PPO because you can go a little bit outside the doctor network, assuming the doctor agrees to the bill. And then what people do like about Medicare Advantage plans is routine dental and vision and hearing is typically included in these plans. I didn't mention this earlier, but Medicare and Medigap do not cover routine dental, vision, and hearing. I know that sounds insane. Somebody didn't think you needed your teeth or your hearing or your eyes, but the reality is it was never built into any of these plans back in 1965, and all the more reason why people tend to get it through a Medicare Advantage or they buy them on their own separately. The premiums are going to be lower. In the case of Medicare Advantage, remember, the benefits can change and so can the prices. In the case of Medigap, the benefits do not change, but the prices do. So when you put it all together, what does a Medicare Advantage plan look like? You'd pay $20 per visit, $50 for the specialist, $200 a night for a hospital stay, $300 for an ambulance ride. I tell people to take the Uber unless you're dying. And you'll see here, chemo, oxygen, and dialysis, you'll pay 20% of the bill, no different than Medicare, but up to the out-of-pocket maximum. And the out-of-pocket maximum in 2021 is $75.50. This is the biggest selling point of a Medicare Advantage plan. This is what you have as protection. So if your expenses now hit $75.50 because you're on chemo or dialysis, the insurance company now pays everything after $75.50. So you're still going to be on the hook for some of this, and it does beg the question for most people, are Medicare Advantage plans bad? Not necessarily, but you must realize that if you get one of these big chronic illnesses or you need an MRI or a CT scan, you're probably going to pay 20% of that bill, very similarly to what you would pay with Medicare in that case. All right, tips for Medicare Advantage. We say build a rainy day fund for unexpected costs. Some of you may have what's known as an HSA account, a health savings account. Those are great because they're triple tax exempt, but keep in mind that at 65, if you file for any part of Medicare, A or B, you must stop the day before you turn 65 contributing to that HSA. You can still take money out for qualified medical expenses and not pay a penalty or incur a tax situation, but you must stop before you hit 65. If you're working past 65 and you're now contributing to an HSA account and you're retiring, let's say it's 68, you must stop 6 months in advance of that retirement of 68. The reason why 6 months, if you're working past 65, is because IRS considers Medicare and Social Security retroactively paying you back by 6 months. And because of that, you must stop contributing to the HSA 6 months in advance if you're retiring at 68, 69, 70, and so on. So how and when you enroll matters. As I told you, the initial enrollment period or during the fall annual election. And I always say, don't forget to evaluate the plan. Why? Because every September, you're going to get this annual notice of change letter when you're in a Medicare Advantage plan. And you want to check that your doctors are still in the network, that they'll be covered, and your medication on the drug formulary is still there. As we all know, there's nothing worse than going to CVS, standing behind 8 people. You get to the front of the cash and then find out in January that your medication is not covered. The good news is that if you're in a Medicare Advantage plan and that happens to you, there is a Medicare Advantage open enrollment period in the first quarter where you can switch out of that Medicare Advantage plan and into another Medicare Advantage plan. All right, number 2, misstep, not understanding the difference. Remember I said Medicare Advantage, the benefits can change, so can the prices on a yearly basis. In the case of Medigap, only the prices change, not the benefits. So finishing up with working past 65, let's see how we're doing on time, and hopefully the phone doesn't ring again. So if you work for a large employer, and this is really where you want to pay attention, I know this is a lot of information, but I'll stop just for a second so you can gather your thoughts and maybe grab a pen and paper, because this is where everybody's questions come. You work for a large employer, greater than 20 people. If that's the case, the group coverage is primary, meaning they pay 80% of the bill, and Medicare is now secondary, so they pay 20% of the bill. In this scenario, you can delay when you hit 65, Part B, which is that outpatient service, and Part D, the drug program, because your company has credible coverage. Most people take Part A because it's free. You get extra in-hospital coverage. Unless you're contributing to that HSA, then you don't want to file for that. You want to delay. No penalty there. In the case of a small employer, less than 20 people, you must file for Part A and Part B. Why? Because now Medicare is considered primary, meaning they pay 80% of the bill and the group coverage is 20% of the bill. So if you don't file at 65, what happens is you're going to probably pay a penalty, not on A, most likely, because you have most of it probably for free. But Part B, you will incur a 10% penalty a year. So if you don't file for 2 years and you were supposed to, you're going to pay a 20% penalty forever. So those of you might know somebody who called up, somebody who worked for a large employer and said, hey, do I need to take Medicare Premium Part B? I don't want to pay it because I have some work history here and I have credible coverage. Well, the small person might not realize they're talking to the large person, and thereby you have an issue, meaning The large person can delay, the small person cannot. And then all of a sudden now the small person under 20 employees is now paying a penalty and didn't understand why. So very important to realize if you're under 20 employees that you do need to file for Part A and Part B at 65. Otherwise, you will incur that penalty. All right, FEHB, a lot of questions in this area on federal employee health benefits. So I think somebody might be unmuted. So just in case they're unmuted, you may want to mute. I'm not sure if that's you, John, just in case. But enroll in Part A and FEHB. You'll pay copays for services as you go. So here's what's important. I just had this question from somebody today on late penalty for Part B. Because FEHB is not considered credible coverage, if you don't take the Part B at 65 when you're first supposed to, you will incur that 10% penalty. So that's very important if you want it later on. You don't pay the penalty just because you didn't take Part B, but if you decide 3 years later at 68, you now need that outpatient service, you will pay it. So number two is you can take both Part A and Part B, the original Medicare, and have FEHB, and then you'll have low to no copays, as you can see here. And most people want to know, well, how do I know whether I should take Part B? Here's the best advice I can give you. Call the insurance company that you have through FEHB. Maybe it's Aetna, Blue Cross, Blue Shield. Ask them, hey, what happens if I get cancer? What happens if I get kidney failure and I need dialysis? What happens if I go for cataract surgery or I go for a knee replacement or a hip replacement? What are you going to pay for? What am I on the hook for? And if they're not giving you the answers you want, and you're on the hook for 20% for a lot of it, that's where you're going to want to definitely make sure that you have Part B for those outpatient and preventative services. There's no one that really can answer this question until you make that call directly to the insurance company. The third part you see here is suspend FEHB and choose Medicare Advantage plan. Remember not to cancel FEHB, because if you do, you cannot get back in. A lot of people suspend it because they want greater coverage through Medicare Advantage plan. A lot of the FEHB plans are Medicare Advantage plans, just so you know. And then no need for Medicare Part D because FEHB has credible coverage on drugs. So you can delay this Part B, or Part D, I should say, in this case, with no penalty. So misstep number 3, enrolling too late. So small employer coverage, as I mentioned, Medicare's primary, where they pay 80% of the bill. Retiree coverage. Companies like Verizon, I believe, offer it. Some other ones do. When you have that situation, it's still not considered credible. You must file for Part A and Part B if you do get retiree coverage. And in the case of the Obamacare plans, those are plans for under 65. If your income's low enough, you will get a tax credit. But when you hit 65, it's not considered credible coverage. Obamacare is not considered credible coverage at 65. So you must file for Medicare Part A and Part B. And if you don't, you'll incur a penalty for not. And of course, you're going to lose your tax credit once you hit 65 on these Obamacare plans. Okay, this is where we come to the end of the presentation. Quick review. So I said parts of Medicare were Part A and Part B. That's original Medicare. You get that through Social Security. As a reminder, Part A is the hospital coverage and Part B is that outpatient coverage. Part C is what you know as Medicare Advantage plans. And that was my analogy where I told you that's the travel agency where you get all of it from one place, the flight, the car, and the hotel, or you can buy them a la carte. You get that through a private insurance company. And if you do need a standalone Part D drug program, you do get that through a private insurance company as well. In the case of what the right routes to go, truthfully, if you can afford it, you get original Medicare Part A and Part B. You add a Medigap plan, as we talked about, and that's that Cadillac coverage. Mostly everything will be covered, and then you add a standalone Part D program. And then in that case, higher premiums, yes, but little to no out-of-pocket expenses and no doctor networks. If you go Medicare Advantage plan, still need to get Part A and Part B, but you'll have lower premiums, more cost sharing, and limited doctors. Similar a little bit to what Medicare is, and that's what you see here. What you probably don't want to do is go original Medicare, have no backup, no supplements, so there's no cap on the Part B, and you're on the hook for that 20% on Part B outpatient services. And then you God forbid you go on one of the major illnesses, you might have a big bill. So good to know for everybody in that case. Working past 65, greater than 20 employees, I said you can delay Medicare Part B and D and A if you want to, if you have that HSA situation, and now no penalty for delaying. Less than 20 employees, you must get all three parts, A, B, and D. Otherwise, you incur that penalty. Most people, I said, get Part D from the company they work at, even if it's a small employer. So you don't typically pay a penalty on Part D for most people. So that's it. I think just the next steps, you see the Centers of Medicare and Medicaid. Didn't discuss Medicaid much. That is for lower income individuals. In that case, you could get help paying the premiums, and you could get help getting the cost sharing paid for you and deductibles. That's where Medicare and Medicaid work together. You can call 1-800-MEDICARE to get more information there. Social Security website, that's where you get all the forms. That's where you file for Medicare. They work together, and that's why Social Security is the place that you typically go to. I always recommend working with a Medicare broker. I've talked to John many times, and we're both on board with this, is that we're trying to give everybody, we're trying to make sure everybody has proper Medicare advice, giving them that Ritz-Carlton Four Seasons type of treatment. Medicare brokers do not charge more versus what you pay buying it directly from an insurance company. People like the fact that the Medicare brokers represent over 30 different carriers versus just calling Aetna, where they only have one insurance plan to sell you. So I typically recommend Boomer Benefits. Boomer Benefits is a national Medicare broker. They have great YouTube videos under Boomer Benefits and Medicare, and they're out of Texas. They work in 48 different states, and they help write this presentation. So they don't pay us for referrals, but obviously we paid them to write this presentation. I haven't met anybody who knows more about Medicare than they do. So Boomer Benefits, if you want to look it up. And then under 65, you got to go on the healthcare market exchange, a healthcare.gov here to buy what you know as an Obamacare plan. It's under the Affordable Care Act. So if you're under 65, based on your income, you can get a discount on the health insurance plan that you have, or that you need, I should say. So with that, I'll stop. John, I'll let you come in here and just see where you want to take it from here. But I'll thank you all for your attentiveness. This is not an easy presentation to digest, but hopefully you got a few tidbits out of it. And I'm always happy to talk to people one-on-one with John to help with your specific situation if you have questions.
Thanks, Danny. We appreciate you making sense on such a confusing topic such as Medicare. If anyone has any questions regarding today's presentation or would like to set up a call with myself and Danny to go over their specific Medicare situation, please reach out to myself or anyone on the team. We'll be posting a replay of today's webinar and on our website in the coming days. Again, our website's cortalegroup.com. Thanks again for joining today, and have a great afternoon.
Thank you.